How many of you know someone who cares for family members or a friend who's unwell, lives with a disability or frail in age? Right there, that's a carer.
So I'm just acknowledging the ancient land and the ancient language, but also acknowledging my elders past, present and emerging, but also acknowledging you of being here today to give me a bit of an opportunity to have a history of this country that you may or may not be aware of.
When you really think about the carer in our communities, it's the unseen workforce, I'd say, that is unpaid, and they're doing that, and sometimes 24 hours a day. So our self is really important when we look at well-being. We know that the carers, they have really high psychological stress at times because of the caring roles in which they face. We have poor health. We put ourselves last. We don't think of ourselves as first. We probably even, don't even end up going to the counsellor appointment or things like that. Those sorts of things. We're really neglectful carers. So we need to educate our mob to try look after themselves while they're in that caring role. I think that's really important.
As an aged care specialist, we could help someone in that part of their journey. So we know that My Aged Care can provide services at home, whether it's through the Commonwealth Home Support Program or our home care package or soon to be staying at home program. We know that aged care can be quite a challenging time for a lot of people, emotionally and also mentally. It's quite a complex system to navigate, as we probably all know.
So with the new Aged Care Act, 1 November 2025, there will be a statement of rights that is built into that legislation, which that includes the right to a culturally safe aged care service and assessment, a right to stay connected to community, and that is now inbuilt into the legislation.
What we're looking to achieve is to collaborate and to get the best outcomes for First Nations elders.
Really excited to hear, some of the things that you guys have written down. It sounds like there's some really, really good conversations happening out there.
But how do we make sure that countrymen can trust us, families can trust us, I think about my nan, rest in peace. She passed away probably 2 months ago now. How wild I would get if I heard somebody had done wrong by her. 2.5 hours to Derby, and I was ready to jump in a car and go there and fight for my nan, and we all are. We all do that. They're our grounding. How do we make sure then that when we're not around, people are still respecting our old people? Because we can trust and we've built those relationships.
Everyone, hello, Whadjuk, welcome, Nanin Quill Dale, my name is Dale, Nan Warandi Bibumanyop, I'm a Warandi Bibum woman. When my brother and I first started our businesses about 30 years ago in the Swan Valley, there were no Aboriginal owned and operated enterprises to speak of. From the coast to the desert, and it is a kundong, it's a kundong.
So we're talking about two types of palliative care. We're actually talking about generalist palliative care, which is every one of you in this room will be a carer. You will have the skills and the knowledge, and you will more than likely have been already practicing as a general palliative care person. It's that conversation, it's all the things we talked about that you do. It's the informal caring, an incredibly important part. You're often looking after someone who's really unwell. So every one of us in this room is a generalist, but we also have specialist palliative care staff, and our staff are extra trained, they have extra knowledge, extra skills, and the ability to look after the really tricky patients, the really complex patients.
that palliative care is really about walking alongside people with serious illnesses, those illnesses that can't be cured, but we could live well, we could have quality, we could have time with family, time with the things that are important, and living with that sovereignty and dignity.
So whether you've supported elders by helping them move house, making cuppers, or helping them navigate a very tricky system, every act of care, no matter how big or small, has contributed to something greater, and we're very appreciative of that.
Aboriginal and Torres Strait Islander people have been saying it for a long time, and it's finally being acknowledged in the new Aged Care Act of 2025. It is integral to incorporate cultural knowledge into all levels of training and invest in our Indigenous workforce development for elder care support. We've been looking after our elders since the Dreaming, and we'll continue to do that until they're welcomed back into the Dreamtime. Let's make sure we do it the right way, with culturally safe training, foundations to build a deadly elder care support workforce. Thank you.